Hello, I'm Ravi Vij from MyCancerHaven, and we are delighted to welcome you to our inaugural Expert Roundtable series, Guidelines in Action, Empowering Community Physicians in the Care of Patients with Multiple Myeloma. MyCancerHaven is a 501(c) organization with a mission to support and empower patients, caregivers, healthcare professionals, and healthcare organizations using dedicated, innovative solutions tailored to unique challenges of cancer care. The goal of this expert roundtable series is to focus on the applications of the available evidence for the care of patients with multiple myeloma. To do this, we have brought together an amazing panel of experts who I'd like to welcome today and thank them for taking time out of their busy schedules to sit down and have this discussion today. Please welcome Dr. Natalie Callender from University of Wisconsin in Madison, Wisconsin, Dr. Ajay Chari from the University of California in San Francisco, Dr. Craig Cole from Carmonas Cancer Institute in Detroit, Michigan, Dr. Binod Dhakal from the Medical College of Wisconsin in Milwaukee, and Dr. Adriana Rossi from Mount Sinai in New York. This program is made possible by a generous unrestricted grant from Sanofi and Janssen Pharmaceuticals, and development has been supported by Cancer Communicator. The focus of today's program is treating and managing patients with relapsed or refractory multiple myeloma who have received 1 to 3 prior lines of therapy. The treatment for patients with multiple myeloma is obviously getting complex with numerous active therapies that are often used in combination with no simple algorithm. And that complexity is amplified in this setting, especially. The current guidelines to the NCCN have 40 regimens listed, and the field is further evolving with some newer data coming in. The multitude of trials that have been done that have compared 3 drug studies to 2 drug regimens, and none of these 3 drug regimens have been compared head to head. The biggest news in this space was the availability of CAR T-cell therapies. We have 2 BCMA-directed therapies that were previously approved for heavily pretreated patients after 4 prior lines. And then in April, the FDA approved, literally simultaneously, cilta-cel for patients who had 1 prior therapy, including a proteasome inhibitor, an immunomodulatory agent, and refractory to lenalidomide based on the CARTITUDE-4 study. We also had ide-cel that was approved after 2 prior lines of therapy, including an immunomodulatory drug, a proteasome inhibitor, and a CD38 monoclonal antibody. Ajay, your practice changed with the advent of CAR-Ts in the 2nd to 4th line space?
Definitely. I think the CARTITUDE-1 data was probably the single most efficacious agent we've had in myeloma, with a PFS of 3 years with heavily treated patients.